All right, coming up in about 2 minutes, Betsy's going to have our up and down weather forecast and where it's going next. But the numbers are up, unfortunately, with the flu. Way up, in fact. Ohio has 3 pediatric cases of flu death, 1 from Cuyahoga County. Nationally, 84 kids have died from the flu.
It's so scary.
A
lot of people have just been really cautious this flu season. There is news on the flu front. Senior health correspondent Monica Robbins joins us now with that. Hi, Monica.
Hi, Maureen and Chris. You know, in Cuyahoga County, nearly 1,600 people have been hospitalized for the flu. That's the highest seasonal total since reporting began back in 2009. And hundreds of those patients are at Cleveland Clinic. Is this flu season worse than past years for children?
Flu season's not over yet, so I really don't know.
Last year, 110 children died from flu. This year, the number stands at 84, and we still have a few months to go. But parents need to know.
So half the children who have died from influenza had some sort of underlying problem. That meant half were completely normal.
That's why doctors stress getting flu shots for children.
A lot of the children that do succumb to influenza did not get the flu shot. The flu shot is one of our best ways to prevent you from dying from the flu. And you may still get a little sick from the flu, but it wouldn't be nearly as bad if you didn't get your flu shot.
The good news, the CDC says the flu shot is about 36% effective in adults and even better for kids. Nearly 1,400 people have been hospitalized with flu at Cleveland Clinic, many of them children. And bacterial pneumonia is usually what puts them there.
The flu also opens up the back door to a lot of different germs that then kind of kick you when you're down and make your pneumonia even worse.
But there's good news on the horizon. There's a push for more funding for influenza treatment, and a Japanese company says it has a drug that knocks out the flu virus in 24 hours. We'll have to wait and see if it gets approved here. So remember this, it's not too late to get your flu shot, and if you or someone you love seems to be getting better but then gets sicker, that is a big warning sign of a potential secondary infection. That's when you definitely need to get to the hospital.
And here's a big question I have. I'm not normally a nervous mother that calls the doctor as soon as there's the sniffles, but this flu makes me nervous. So when do I make that call to the doctor or take the kid to the ER?
Dr. Esper says if the fever has been over 103 for several days, if the child is lethargic, you can't move them. If they refuse to eat and drink, especially, because that can lead to dehydration, and also mainly if there's trouble breathing. And you as a mom, you're going to know. So whenever you question it, make sure you just call your doctor, ask for advice, and in those types of situations, get them to the hospital.
All right, great advice, Monica. Thanks. Sure. Back over to you guys.